Or one of
This particular bite is in the area of the carotid artery and the internal jugular. If you got upset and started biting harder, it could injure the carotid.
If you want me to follow you back,
Could bleed out in about
$2 and I'll follow you. Send it to my Cash App, $ I love God 410. People, soon as you come in, I'm trying to get 3,000 likes. Please tap the screen. Hey Jennifer, how are you?
I have no clue as to how to do this. No clue at all.
Hello Jay. James Bossman, how are you?
Hey, let's make sure those trauma kits are signed up and bring in a couple more ventilators.
Grandma, how are you?
They're saying the first bounds of the hurricane are 2 to 3 hours away. I'll tell you right for us.
Please, everyone tap the screen.
We know exactly where it's going to make landfall. The community that I'm working in is going to be the one that's hit.
We'll keep you posted with special bulletins as the storm progresses.
When a hurricane is approaching, it's a very anxiety-provoking situation. That's true for the ready for discharge.
Single, one man's woman, how are you?
Is to try to get all the potential patients that need to be discharged
What?
out of the hospital.
What are you talking about?
So that the patients don't get caught.
Let me block you people.
The supervisor just called. He was about to send a bunch of staff home, so one of them had a rational, so we can send her down. Sure, send her down.
He's calling me. The neighbor spotted him stumbling around in his front yard. The neighbor said his name was Craig.
Craig, another Kreider. You know where you are right now?
Storm's coming. There's not much time.
The patient is agitated. He's making some clawing in the air, and I can tell he's very confused and almost delirious. Did the neighbor say anything else?
Just that he's never been like this before.
Timothy, Kelly, how are you? Chad, Mad Dog, how are you? John,
Get him to Bay 1.
Russell, how are you?
On my count. 1, 2, 3.
Help me. To the light. Please.
My first thought when I see him is heat exhaustion. It's very hot and muggy outside as the storm approaches. Let's get his temperature.
Thanks for the
Can
likes.
you tell me what you were doing before you got to the hospital?
Appreciate it.
His temperature's normal. It's not heat exhaustion.
Break.
Heart rate's 125, respiration's 30, O2's 96, BP's 135 over 92. Craig, are you feeling pain anywhere in your body?
Just really can't focus on me.
They're gonna come. The storm is gonna bring them.
His skin is dry. It is bone dry.
Just give him a liter of normal saline, a milligram of lorazepam IV, and let's get him on some oxygen. Craig,
This isn't gonna hurt. As I'm performing the exam, he focuses straight on me, and he says,
Andrew, what's going on? God bless you too.
angels, heaven. It for me as a caregiver.
I'm on here trying to raise money
They really
because somebody stole my jacket out of my girlfriend's son's truck.
Paramedic supervisor John Gary has been on the job for 14 years, but today is the one day he'll never forget.
Honey, how are you?
We were responding to what seemed like an ordinary workplace accident. On that day, we had a very green trainee riding along with us. Are you nervous? Copy that. This was the one in the Millington call. I pulled up onto the scene. I noticed that there was a police officer there.
Everybody tap the screen, please.
For the first time. guess I could say I've prepared myself.
Can anyone donate $2 from each person, please?
There was a police
So
officer
I
there.
can get
Turns
a
out it
winter
was
jacket.
past paramedic of ours, Officer Warren Lilly.
He's got a good pulse. He's really bleeding.
Warren had the training and the presence of mind to apply pressure to the wound to stop the bleeding. Slide this back open. I want to see what do you got here. What's your name, brother?
James Johnson.
He was a tree cutter, and he apparently had struck himself with a chainsaw.
Scooter, how are you?
Well, Mr. Valentine held the saw in his neck as he lowered him down to the ground. When he got to the ground, his other co-workers held the saw. They knew enough to not pull it
My
out.
Cash App is money sign I love God 410.
Still talk to me and communicate.
The video is on my TikTok
Before we get you going to the hospital here, we're gonna
of
do something.
the guy breaking into, well, getting out the truck.
We're gonna let the hospital do that. Vanessa, can I have another trauma dressing?
And he has
We're gonna leave the object in place. You don't know what kind of damage you can cause with the object coming out.
my jacket under his underarm.
Cause the patient to bleed to death. On a scale 1 to 10, 10 being the worst.
Hello, Queen Bonnie.
I don't know, maybe 5? Can't feel much. Can you guys hurry up?
We're hurrying, please. Vanessa, I need you to hold this for me. Just apply direct pressure here. County Baker Avenue, please. Can I get an ETA on the med unit? Copy that. Because the location of where it was, the actual angle of the bar.
You know, it's sad when you can't even leave nothing in the truck where you live at.
We needed more help and we needed it fast.
Shannon, how are you?
About that time, through the door burst the local game warden. Under no circumstances can you kill that turtle, Doug. If that turtle dies, you are all going to jail.
Dr. Boxley has no idea how to remove the turtle from his patient's neck.
This turtle is in exactly the place where the carotid artery is, and he can clamp down and sever the carotid artery, and my patient will bleed to death in minutes. Go call the game.
Batman, what's going on?
You boys know any tricks for getting turtles off? Well, you're experienced noodlers. I thought maybe you knew some tricks, and we wouldn't have these medical options. Oh, maybe we made a time.
Buzz the jeweler.
His good old buddies are still making comments and laughing.
Buzz the jeweler, what do you sell?
I have an idea.
And one of the nurses comes up with a kind of a unique idea.
Okay.
Let me know, maybe I can do a promotion.
Why don't you pour cold water on it? Or submerge it in cold water and maybe it'll fall asleep or hibernate and let go.
It's not actually a bad idea. Go ahead, go ahead. We get some ice water, and we start pouring the ice water on the turtle's head. The turtle does not like that. Stop. So there goes.
John Boy, how are you?
Maybe we should use boiling water.
If everyone could please tap the screen, please.
A lot of stress. You named it? You gotta be kidding me. Yeah. Go get me a couple of warnings, please. About that time, through the door, oh, hi, Warden Dr. Slade. Thank you for coming. First, the local game warden. Under no circumstances can you kill that turtle, Doug. It's off season. So I don't plan on killing it. If that turtle dies, despite the doc's best efforts, you are all going to jail. Regardless, I'm going to have to cite you for removing it from its natural habitat. It's been attacked. I didn't want to remove it. I'd have been more than happy to leave it there. And why should I have to go to prison on account of his stupidity?
Dr. Crichton is trying to clear out for you. Dr. Crichton is trying to clear out her yard before a hurricane hits, but a delirious patient has her baffled.
When they start talking about angels, heaven, it, for me as a caregiver, signals to me that they really feel as if they're dying.
I hear angels sing.
I have this young, healthy appearing male that is acutely delirious and hallucinating. I'm trying to figure out what's happened with this patient, and it occurs to me that, you know, maybe this could be head trauma.
Let's get a cervical collar. There's a hurricane coming. He could have been on his roof, on a ladder. He could have fallen off in his head.
So I'm looking at his head, palpating his neck, looking externally for any signs of injury. I see no signs of blunt trauma, no signs of a fall.
What do they sound like?
They're coming for me.
He doesn't appear to be in any pain, no signs of any external trauma. It raises my suspicion for mental illness or drug abuse.
Let's get a CT head, CT, C-spine, and a chest x-ray. Let's order a CBC, PMP, urinalysis, chemistry, and blood alcohol level. It works, you got it. I need to keep my differential diagnosis wide.
The tension builds as the hurricane gets closer.
Where are you from, Cracker Barrel?
Oh, and the patient upstairs is in for
Chest
cleaning
Barrel
the rest.
or something?
Okay, thanks.
Where are you located?
Dr. Kreider.
Hey, Don.
This is May. May is Chinese. She really doesn't speak much English, so I thought I should be here.
Hey, May. I'm Dr. Kreider.
I noticed her rash just as I was about to send her home.
Has the housekeeping department been using any new cleaning chemicals recently?
None of my other staff have a rash. But I apologize, I really need to get back. Can you notify me when she's clear to go?
Sure thing. May, can I see a rash? No English.
I try to converse with her, but there's a definite language barrier.
Can I see your rash?
Rash is typically a visual diagnosis, doesn't need much of a workup or evaluation, so I figure this will be a quick and easy in and out. I see some dark purple to blue areas covering her arms and to legs. She's got a couple places on her chest and her back, very unusual, and I know that this is not going to be my quick, easy in and out diagnosis.
Nicole. Yes.
I'm going to need a CBC, PT, and PTT. I've got to have a Chinese interpreter. May, I'll be back. A rash that is large and purple-blue like this, the differential diagnosis is pretty large. Could this possibly be leukemia? Could this be some type of bone marrow failure like aplastic anemia? Does she have some clotting disorder?
Craig's roommate just called. He's on his way. He says Craig's a diabetic. What was his blood sugar from the paramedics? They said it was normal. Let's check another one right away. I will assume he's back from CT.
The angels are here! They're coming! Can't make me stay! I'm calling an ambulance here! Follow security!
I need security to CT. Stand.
Paramedic Scott Gary is supervising the rescue of a tree trimmer with a chainsaw in his neck.
The most unique situation was that he was still awake and talking. 15 to 20 pounds. Sitting way out front was going to cause significant issues with the actual blade and its stability. That weight was obviously pushing down on the far end of the bar, and that's where all the vital parts were meant to go. We had to weigh the option of transporting it with it bouncing in his neck, or taking it off. We're gonna take over.
Like that?
Now we gotta do something about this saw.
You can take the motor right off, take the bar and chain.
Let's do it. I was very tense. It was a risk-benefit assessment at that point. How you holding up, James?
Not so good.
Multiple people grabbed onto the bar at that point, trying to hold it steady and prevent it from digging into the gentleman's neck any further than it was.
All right, here we go.
The bolts were over-tightened.
Let's go.
It was a tense situation. When something doesn't work, you get that doubt in your mind, like, oh, is this what we were supposed to do? Stop.
Anybody have any other ideas?
Monitoring plug is nostril.
I have seen a snapping turtle hold its breath for more than half an hour.
Again, Warren has warned Dr. Slade that if he kills the snapping turtle on his patient's neck, these catfish noodlers are going to jail.
and the law, Warren, we have no intention of killing that turtle or letting it die. Their replacements show up. Why don't you two boys go take a break in the waiting room? And these gentlemen are going to take over for you, okay?
Hey, sorry, Doc, I'm not going near that turtle.
I can't believe this has happened. Because our orderlies want nothing to do with this turtle. Listen, I know your concerns, guys, but you're going to be fine if you hold the turtle like the boys. Besides, it's going to make my job a lot easier to keep them out of there. Not to mention, it's your job. And I talked two of my orderlies into coming in and taking control of the animal. They reluctantly did so.
Thank God. Yeah.
You can't drink that in here.
You don't know? I'm one of these beer.
You can't have one either. I managed to get the two good old boys out of there, but we still have the turtle firmly attached to my patient's neck. Anybody have any other ideas?
How about if we block his nostrils? I mean, it needs to open his mouth to breathe, right?
And so I consider that, what am I actually going to block these nostrils with? And am I actually going to apply whatever it is there near the turtle's mouth? I'm a little reluctant to do that.
I thought turtles could breathe out of their rear ends.
Seriously? Some turtles can.
Well, breakdowns are costly, but with endurance, you could never pay out of pocket for a costly repair again.
They covered a $14,000 head replacement. Don't wait. Visit EnduranceWarranty.com for $300 off any plan. Or a way to stretch the dollar? With Insurify, you can cut your car insurance bill in half. Getting a deal on car insurance with Insurify is super easy, and all you need is a phone and a finger. Scroll through dozens of prices and tap and switch online. That's it. No phone calls and no wasted time. It's just like searching for a flight or hotel online. Enter your car information, and Insurify does the rest. Go to Insurify and save today.
Check if you're overpaying for car insurance. Go to Insurify.com.
Do that.
I thought turtles could breathe out of their rear ends.
Seriously?
Some turtles can draw oxygen out of the water through a sac in their anus, but not this kind. However, I had seen a snapping turtle hold its breath for more than half an hour.
And I decide that, well, he's probably right. That is not going to work because this thing doesn't really actually seem to need to breathe for a while. So now what?
Those nights you get in there and do the thing. This is the worst thing to go.
It finally occurs to me, what if we paralyze him?
You can't paralyze a turtle.
It would just be temporary paralysis. There is a drug that we use in the emergency room when we're going to intubate people who want us to not move, not breathe, or not do anything so that we can get the tube in them called succinylcholine.
Oh yeah, it's paralyzing.
It does make everything relax. And I'm thinking, well, gee, I could give a shot of succinylcholine for Susie and she'll let go.
Excuse me, doctor, but if you give her succinylcholine, you'll need to intubate to keep her alive. Have you ever intubated a turtle before?
And the answer to that question is no.
How did I do it?
She's peeing on me.
If you ask me, that was Susie's way of telling me what she thought of my idea.
The victim of a tree cutting accident needs to get to the hospital fast, but the medics can't move him until they figure out how to remove the heavy motor from the saw stuck in the man's neck.
15 to 20 pounds sitting way out front, pushing down on the far end of the bar, and that's where all the vital parts of the neck go. Stop. What do? Is there a better way to do this? Is there a different way to do this? There wasn't, and it had to come on. But we gotta try this again. Once the bolts were free, we had to get the chain from around the clutch. How you holding up, James?
Go ahead.
Okay, we're gonna get down. We're gonna pull it out there.
Alright guys, make sure we support this blade. Vanessa, can we get some tape? We took like 80%, 90% of the weight off the saw. So we knew we would be able to safely facilitate transportation of this guy to the hospital. We picked him up, moved him over to the stretcher, and lift under it. 1, 2, 3. Throughout the entire movement, someone physically held onto my belt, supported my back while I held the chainsaw bar in the patient's neck throughout the entire transport. If I would have moved that bar left or right any different way, it could have caused an injury that was catastrophic. You don't let me move, okay, Vanessa?
At the hospital, news of an incoming patient travels fast. One of the first to find out is trauma surgeon Christine Taves.
The pager went off that there was going to be a chainsaw injury coming in. But the thing that went through my head when this occurred is that this could be catastrophically bad. There were very many injuries. He could come in dead. He could come in near dead. It was stupid.
Blade's still in the neck. They've taken up the motor.
It's still in the neck.
Still in the neck.
Right.
Yes. Relax.
It's incredibly important to work as a team.
Hey, it's Taves. Yeah, set up a room. We'll need vascular, let anesthesia know.
Once you're at this level, it's really about the team, and especially in trauma surgery, it's immensely about the team.
Christine, with 5 minutes out.
Okay, it'll be about 5 minutes when they're here. Okay, thanks, bye. Activate the massive transfusion protocol, please.
100 micrograms fentanyl, IV.
Copy that. 100 micrograms of fentanyl IV. Couldn't be James. We're gonna take good care of you, alright? Hey, keep your eyes open. Keep talking to me, James, alright? Keep your eyes open. Held the bar on the neck all the way to the hospital because something as simple as stepping on the brakes too hard could have been very detrimental to this guy.
We often have a variety of people rotating through the emergency department who want to come and see. And it's important for their education to see. But it's also my job as trauma attending to do crowd control. Alright guys, move!
Hey Doc, this is James. He's 21 years of age. His blood pressure is 122 over 84. His heart rate's 96. Say hello to the doc, James.
Hey, James, I'm Dr. Taves. Can you talk to me?
James, open your eyes.
Open your eyes, James.
Dr. Kreider's delirious patient has suddenly become dangerous.
I need to carry the CT. Stat. Get him some prazodone, 20 milligrams IM.
I'd sent my patient over to the CT scan, and he's gotten very combative, and it's just wreaking havoc. And this hurricane is about to hit. I'm just hoping that if he did have the cervical spine injury, that we haven't just made it much worse. We administer a sedative. He's much calmer now.
Get his IV back in and let's put a cervical collar on. Craig, calm down, buddy. We're here to help you.
Let's get that blood glucose level. The patient is a diabetic. This has to be the diagnosis. His blood sugar is just low. If it is a blood sugar problem, we just administer some IV glucose, and typically it's amazing how quickly they'll turn around and start acting.
Craig, we're here to help. You're safe, Craig. You're in the hospital.
Blood sugar is 89, all normal. That's not my answer I was hoping for.
The storm is moving much quicker than we expected.
You never know what's going to happen in a hurricane. There could be flooding, buildings could collapse.
Face that work?
Seems normal.
Typically, checking blood work on a patient helps me solve the diagnosis, but unfortunately, I still have a puzzle.
May. Did this happen at home?
Her rash looks like it could possibly be bruising
Fall?
or else abuse. We really need that interpreter.
I could get Aiden to agree to come in. The hurricane is less than an hour away.
Well, that's quite an impressive x-ray.
The real concern is that he's going to bleed to death. You can literally hear a pin drop in the room.
Is everybody ready? I'm going to take this out.
It's part of the journey. Even when we have heart failure. But when he had shortness of breath, carpal tunnel syndrome, or back pain, we wonder if these people need something bigger. Thank goodness we called this cardiologist.
because these were signs of ATTRC, a rare and serious disease that gets worse over time. If you see any of the warning signs, don't wait. Ask your cardiologist about ATTRC today.
21-year-old tree trimmer James Valentine is being rushed to the ER of trauma surgeon Christine Taves.
James, I'm Dr. Taves. Can you talk to me? James, can you hear me? He's talking to us, and that told me a great deal. He's awake. He needs to follow commands, and his airway is intact, and all of that's important information. Okay, guys, let's move it, please. On my count, 1, 2, 3. Okay, guys, let's get his clothes off from you. You're gonna hold the blade.
I tend to wear my emotions on my face. I rarely have to say what I think. Most people can tell.
Okay, I need a chest x-ray now, please. Let go of the blade. All right, guys, let's get all the dressings down.
Step out. The neck is sort of a very frightening area, even for trauma surgeons. It's a lot of what we call high real estate in a tiny area. And so there's lots of things that can be damaged with just a millimeter difference in size.
Dr. Sharma, are you on any medication? No, sir.
It's always a team effort. I am the one that is ultimately in charge and drives the ship. I'm the captain of the ship.
Wiggle your toes, James.
Wiggle your toes.
Okay, I have a habit of pacing. So I'll start on one side of the stretcher and I'll pace around to the other side of the stretcher and then I pace back and then I pace back and kind of get an overview of the whole situation. When I'm walking back and forth, you cannot be in my way. I was concerned that the chainsaw had gone deep into his shoulder and potentially injured his chest. Most importantly, pneumothorax, which is air in his chest cavity, or a hemothorax, which is blood in his chest cavity.
You're going to stay there. You're not going to let go. Everybody ready? Okay. X-ray. Fuller's ready for you, Doc. Okay. Right arm down. Don't let go.
Still didn't have an ability yet to assess how much blood loss he had or whether or not there was massive bleeding.
Good luck, Dr. Taves.
Thanks, guys.
Out of the room they went, and they were gone. And that was the last we saw of you.
Once everyone's ready, I make sure we've got blood in the room, anesthesia's completely ready for the worst, which means they've got medicines to push in case his blood pressure drops. I have all the appropriate instruments I could possibly need in the room.
Okay, James, we're going to put you to sleep now, okay? Whatever happens, you're going to be okay. All right.
James was really amazingly composed and together for all this.
Okay, guys, let's take a look at that x-ray. Well, that's quite an impulsive x-ray.
Chest x-ray was an important step to rule out another body cavity I might have needed to enter in order to try to save his life.
I don't see any hemothorax or any pneumothorax. I can't tell if the carotid's been ruptured or not. Well, there's certainly only one way to find out.
The real concern is that the chainsaw is holding.
You have FE on standby? All right.
And then when we take it out, he's going to bleed to death.
All right, let's get ready. I'm going to take this thing out, guys, okay?
You can literally hear a pin drop in the room. I don't think I've heard an operating room that quiet in a really long time.
Okay, guys, everybody ready? I'm going to take this out.
The California hurricane closing in. Dr. Kreider needs to quickly diagnose her patient's rash.
Oh, the patient keeps just telling me home, home. So it occurs to me maybe she's telling me this happened at home. There's no way we're going to be able to get her husband and a social worker in here in time to sort this out. Maybe there is another way we can figure this out. May I, if it's bruising, it'll be tender to the touch. Ow? Ow? Or it's not bruising. Huh? Maybe she's telling me she wants to go home. I'm just stumped. Makes lab results are in. I'll be back. No drugs or alcohol. Lab works all normal. Emergency. It's radiology. Dr. Kreider. Radiology managed to get a CT head and CTC spine before the patient became traumatic. Okay, thanks. CT scans are clean.
Dr. Kreider, he's been cleared to be discharged.
Determine the cause of a rash.
I have less than 30 minutes to send people. would you mind stepping in there?
Suddenly, there's a warm sensation that one of my tax notes is on his right leg. And sure enough, Susie has decided to relieve herself in the middle of all this.
With the threat of jail hanging over everyone's heads, Dr. Bobsley must find a way to save the lives of both his patient and the alligator-snapping turtle on his neck.
I gotta go find out how to innovate a turtle. I had a friend who was a vet. Well, how difficult is it to innovate? He said, innovating turtles is easy. Okay, thanks, Rich. Barbara, could you please give me a pediatric innovation? When I woke up that morning, I sure didn't think I'd be intubating a snapping turtle.
What dosage is that?
I calculate the dose for about a 30-pound child. 100 milligrams. Barbara, let's make sure the vascular surgeon is standing by, please. If this thing goes sideways and punctures Bo's carotid, I'm going to have to concentrate on the patient, not Susie.
Let's get on with it.
Let's give Bo a milligram of lorazepam so I can hold still. I'm kind of shaking. I'm nervous about this whole thing. Here we go. Stick it in. Draw back. I get blood. Let's give Susie a milligram of lorazepam IM, which is a calming agent.
Did you kill her?
This is Craig's roommate, Jeff, and I'm just counting on the fact that he can give me some more information. This
Yeah, that's what they are.
and Craig made lunch right after.
Yeah, that's right.
If we don't take action now, he could go into renal failure, he could have cerebral edema.
Dr. Bustamante usually must know a chainsaw that is embedded in the neck of true trained James Valentine.
Everyone's really, to some degree, holding their breath as we go to take the chainsaw out. Everybody ready? Okay, here we go. Waiting for the absolute worst, which is this massive rush of blood.
Jeff, how are you? G-Money, what's going on?
And there's no blood. Everybody goes. All right, throw this in the trash, please. I pat.
Y así es como te atreves a comparar. Nada como ver a un cliente feliz disfrutar de un nuevo seccional Bosch, envuelto en la comodidad inigualable de asientos de Pogo Big Memory Foam, con 13 cojines que ya vienen incluidos, seguros de que no van a gastar cientos más como si se hubieran comprado un sofá similar de la competencia. Y lo más importante es que...
gratis.
¡Exacto! Si es que ahorras cuando te atreves a comparar, en tiendasoldabox.com.
All right, throw this in the trash, please. I passed the saw off to one of the nurses in the operating room with direct instructions to throw it away. It has blood and dirt, tissue in it, and there's no really good way to clean it. And so it needs to go away quickly, so no one wants to save it as a trophy. We could tell exactly how far away we were from the carotid artery, which was really a very small distance, about much smaller than a dime. The carotid is intact. Okay, a couple of millimeters in the other direction, and James may not have survived this at all. Let's go ahead and give him some antibiotics, penicillin. I'm gonna go ahead and get scrubbed. I'll be back in a minute, okay? The wound has some tree in it, some dirt, some other things, so we clean that up pretty vigorously, and we go through the wound together. The wound itself is not a clean cut, like it would be with a knife. This is a chainsaw, so the edges are raggedy. The muscle is cut. He did an enormous amount of damage to the muscle in shoulder. And so the question becomes, how much of that muscle is going to work?
trachea is intact. All the major structures are intact.
That is immediately great relief. But we're in no way out of the woods.
It looks like he's got extensive damage to the muscle, sternocleidomastoid, the traps. We'll have to see how he does. He's got a lot of damage to the muscle. Blessedly, when we took the chainsaw out, the major structures in the neck were not injured, such as the carotid or the esophagus or the spinal cord. However, there is a lot of muscle damage to the shoulder and to the neck.
From the time we put him to sleep to the time we finished was a little under an hour. And then I followed him very closely. I want to do a thorough exam to look at his arm and how badly it's damaged and how quickly he recovers function.
Morning, James.
Morning.
How are you today?
Started ready to saw up and cut it till I got to the hospital and took me into surgery.
It was a big deal yesterday. We almost lost you.
Sitting up in bed, and he's awake, and he's talking, and he's got this big bandage on the side of his neck, and he looks awesome.
I mean, yes, I was scared, just trying to get myself together and not freak out or anything. So it could have been a lot worse if I did.
Your white count looks good. I've got you on some antibiotics. There's a lot of dirt in the wound. We'll see how your arm's doing, right? Okay, now squeeze my fingers. There you go. All right, lift your arm up.
That's a huge success right off the bat. He's able to move his arms.
That's as far as I can go.
Actually, that's pretty impressive. It's better than I thought.
I've got a fair amount of enthusiasm in my voice because I'm so excited that he's done really well. And James is very matter of fact and goes, yeah, it's a good thing I'm alive.
Hopefully you'll be able to get back to work in the next few weeks. We'll have to see how you do with physical therapy, okay?
Thank you.
You're welcome, James. I'll see you tomorrow, okay? If you need anything, you let me know. Okay?
Tom, can I have my saw back?
No, you cannot have your saw back.
Thanks to the doctors and the paramedics and the police and my field workers for sure.
Dr. Kreider has very little time to discharge her non-urgent patients before the hurricane hits.
Michael? No, sorry. Without an interpreter, I'm caught between sending this patient home without really knowing the cause of her rash or keeping her through the hurricane. She could potentially be at home for several days and not be able to come back to the emergency room.
Your thing is following our wind.
Stay here. I see the patient reach for her cell phone, and I see that the uniform is a dark purple color. Is this May's uniform? Well, the cleaning staff uniforms were white.
No, we just changed this week.
And he tells me, oh, we just switched to purple uniforms. Nicole, can you give me some soap? Yep. And magically, the rash disappears. She's discharged. May, you can go home. He's gonna come off in the shower.
Not bad, Doc.
No problem. I'm just glad that it all worked out and I was able to get the patient home with her family as soon as possible. I've got this diagnosis nailed down.
Dr. Kreider, this is Craig's roommate, Jeff.
Hey Jeff, thanks for coming in.
Yeah, where is he?
And I'm just counting on the fact that he can give me some more information about the patient.
Oh, yeah.
Does Craig have any other medical problems besides his diabetes?
That's all I know of. And we've been roommates for a couple of years.
Anything like this ever happened before, even involving drugs or alcohol?
I go through drugs, and he's like calm, happy drunk.
So far, the roommate hasn't been much help. We're in a serious time crunch. What was Craig doing the last time you saw him?
We were getting ready for the storm, you know, boarding up windows, bringing plants in off the deck, and I went to go buy a flashlight. But it was making lunch when I left.
What kind of flowers?
Just some veggies and these special flowers that Craig had. I don't know.
What kind of plants?
Trumpet flowers? Sorry, I really don't know.
In the area where I live, there's an ornamental plant that lots of people grow, and it's called angel trumpets. Every single part of this plant is toxic. This is an angel trumpet.
Yeah, that's what they are.
and Craig made lunch right after,
Yeah, that's right.
even a few seeds or parts of a leaf could be deadly.
Did you kill her?
Come on, Susie. I try to listen to her lungs, but I can't hear anything through that shell. And we wait. Come on, Susie. And we wait. Come on. Come on, girl.
Dr. Kreider may have finally discovered the cause of her patient's delirium.
You mean there's something in those flowers that made him lose his mind like this?
With anticholinergic toxicity, you get a fast heart rate, you get delirious, you get very dry flesh skin, and very wide pupils.
yes, and if we hadn't have caught it, we could have killed him.
Harsh.
We'll start him on midazolam, 2 milligrams an hour, give him 150 cc's of normal saline an hour.
It's very, very likely that he has ingested this plant, and that's what's causing these symptoms.
Infusion started.
If we don't take action now, he could go into renal failure, he could have cerebral edema, he has the potential to have seizures.
We're going to move Craig up to the ICU before this storm hits. I want you to get on home. We're going to take very good care of him.
Okay. Thanks.
I definitely know the diagnosis. We are getting him to the ICU. We're going to give him the treatment that he needs, and he's going to recover. As I'm telling the roommate to go home, it dawns on me that he's got a house full of angel trumpets.
Jeff, I want you to get home and get safe before the storm hits. But when you get home, put on some gloves and move all those angel trumpets outside. When you come back inside, wash your gloves and hands really well.
Got it. Thanks.
First bands of the hurricane are supposed to hit in 15 minutes.
I'm relieved that now I've got a clean, pretty empty emergency room. I've taken care of all the patients that I had, so I feel pretty good.
There's a quote from a legendary coach who brought me from Notre Dame.
And what quote is that?
He used to say, I never ask a player if he has the will to win. I ask if he has the will to prepare.
Good job, Steve.
The game warden wants to know if Dr. Slade has just killed the turtle attached to his patient's
Why
neck.
is she still left on? Did you kill her?
And lo and behold, her mouth drops open. Oh, wow. You look where the bite is. And see,
How bad is it?
it's not bad. It's not bad. He has a little bit of a superficial laceration and some swelling, but there's no active bleeding, thank God. So you're going to be fine. We're going to clean it up and give you a tetanus shot. But now, Susie has stopped breathing.
Get back, doctor.
Let me just back him up. Just go. I've used a pair of forceps to force her mouth open. Okay, Susie, here we go. I go down the base of the tongue, and there's a little epiglottis up and down. Slide the tube in. Thank God it went in. To the back. Start there. We hook it up to a little pediatric bag and oxygen, and we start ventilating. Okay, back to the resistance. We put a little piece of plastic in there because we know when she wakes up, she might bite that tube into it. It might stay in there, and we won't be able to get it out. Keep bagging. I try to listen to her lungs, but I can't hear anything through that shell. There's condensation tubes in. Back to your resistance. Keep going. But we do notice that we're getting condensation on the tube. That means it's in the right place. Come on, Susie. And we wait. Come on, Susie. And we wait. Come on. Come on, girl. She's doing it. Okay, okay. And lo and behold, Susie starts digging, opening her eyes, and breathing on her own. She's moving. Okay. Okay. All right, listen. I'm going to pull the tube out. I'm going to pull the tube out. But sure enough, she wakes up and she's moving around and everything. And we decide it's time to take her back to the swamp where she belongs.
Leave those turtles alone from now on, right?
Yes, sir.
Later, Susie.
Best looking hickey you ever got.
Listen, you boys are good to go as well, okay?
All right, thanks for keeping us off the chain gang, Doc.
And everybody goes home. Everybody's happy. Still thinking about getting that turtle for your son?
Oh, yeah. I'm thinking goldfish. Definitely goldfish.
stories in the ER that doctors never talk about.
Skydiving accident by Interstate 80.
When I hear skydiving accidents, most of the time I never see them. They're dead on the scene. Oh, guys, it's a ghastly sight. Well, that is. The object that they were impaled on was a T fence post that has tines like little teeth. Oh, get it out of me.
The first thing I noticed is a lady in a wedding dress. She's got her finger stuck in a jar. This was a thick glass jar. There's a good chance we could break her bones. It didn't take long to realize that this wasn't going to work. I need to talk to Anne about I'm thinking her wedding is pretty big.
That's not you down, sir. Can you speak?
Whoa, Patty?
Is Patrick taking a drug?
Sir?
Yeah, can you speak?
Whoa, Patty?
Is Patrick taking a drug?
Sir?
EMS.
EMS responded to skydiving accident by Interstate 80. They're reporting 2 injuries. We're routing them out to you. Copy that.
Hallelujah. So they're real for once.
I'll go get the shuttle they prepped.
Can you all tap the screen, please?
When I hear skydiving accidents, most of the time I never see the victim. They're dead on the scene.
Deep Sea, Texas, what's up? What's going on, G Money?
One patient on the stretcher.
Trying to get some people to donate so I can get a jacket.
Oh, guys, this instance, I have
German Shepherd, what's going on?
It has 2 individuals laying next to each other as tandem parachuters would jump.
Fence post, head backwards, ripped it right out of the ground, right on the bolt stable somehow.
It's a ghastly sight because
Trying to get 3,000 likes.
individuals. Never have I had anyone that's impaled on a fence post together, and never in my career.
Are they a couple? No. Instructor Jean, student Sharon. It was her first jump. Okay, come back to me, Bernie. Good luck.
There's no expectations of privacy between the 2 individuals, and you're doing your best to do all the things that normally there's not enough room in one room when it's a major trauma anyway. Now you've got that multiplied times 2, so it's a fairly chaotic scene.
I'm never doing this again.
Can you tell me exactly what happened?
It was awful. She dragged us for like ever.
We hit the fence.
It really hurts. My leg is killing me.
They were both in serious amount of pain, as you might assume. Bart, I want you to open all these IV spots. I want you to type across with 6 units of XLZ. Alright? And I need you to get 10 milligrams of morphine IV now, and I need you to get Sharon 8 milligrams of morphine IV now. Okay? It was extremely difficult to get their clothes on. Right, careful guys, I don't want that post moving at all, alright? Because any time you move the patient, you move the post, and you cause extreme pain. One of the tenets of trauma medicine is you do what we call a primary survey, which is a very fast kind of head-to-toe assessment. Clearly the most life-threatening thing at this time is the post. All right, hang in there, guys. You're doing great. The post entered the instructor through his lower back and then entered the student's lower back and went up.
G Money, would you have $2 you could donate?
Where's the trauma surgeon called?
Dr. Covey.
All right, get him here now. There's no way that I can get that post out of 2 people in this purpose room by myself.
Well, that is it. Well, the object that they were impaled on was a T fence post that has tines all along the side of the post and actually acts like little teeth. So as the post impaled them, it's almost like a zip tie. You put in through the zip tie, and each notch that you can pull farther in, but you can't take it back off.
lodged very securely, and it acted as a secure. In fact, you could barely even get your finger in between the two bodies at the point of the attachment of the post here. That's what we're trying to do. We're just trying to figure out the safest way to do it. Okay, sweetie? There is no way that I can take the fence post out. The fence post is hand-body, meaning one that's sort of more lateral structure. Within the doors and taken away.
I'm awake. Thanks. Appreciate it. You think you can donate, bro?
We notify the trauma surgeon. The trauma surgeon is tied up in another case that may go on for some time. What does he expect to be done?
Doesn't know, said it's a complicated case.
We have two very serious injuries here. For right now, the emergency department, I'm on my own.
My dad taught me to seek adventure, to respect nature, to love it. Now I want to protect it for my son and the next generation. That's why I got a Subaru BB.
Subaru Solterra, powered by God. Finance to yourself as up to 24/7. It's going up now.
Los precios bajos todos los días. De modo, ya no hay por qué regatear para obtener lo mejor de lo mejor.
Amor, quiero una recámara estilo lustro. Con luces en la cabecera, cajones forrados con cedro y fieltro, puertos de USB y cajones de almacenamiento en la cama. Todo por $1,500 menos que las otras tiendas opcionales.
Si es que ahorras cuando te atreves a comparar en tiendasurimacops.com.
Breakdowns are costly.
Start making some really weird noises.
If your check engine light comes on tomorrow, the repair could easily cost thousands.
With the transmission.
But with Endurance, you could never pay out of pocket for a costly repair again.
They covered a $14,000 and replacement.
$1,400.
Endurance paid it.
Who's going to pay for your next car repair? You or Endurance?
Call right now to get $300 off any plan. Call them now.
Think about bulking up if you gotta keep driving to the basket that much. With your height, you should work on your post game.
Sports and medicine go hand in hand in the emergency department of Dr. Travis Jasper.
I love sports. I coach basketball in my spare time, so anytime someone comes in with a sports injury, I always give them an extra piece of my mind, free of charge.
How do you know you like basketball, Dr. Jasper?
Dreamed of playing in the NBA when I was a kid.
I dreamed of being a detective.
We need help.
Then all of a sudden, we see two young men come through the door. Can we get some help? In the ER, we expect that people are out partying on Saturday nights. Where were you guys?
Dean's Club.
How much did you guys have to drink?
I had like half a dozen beer, but you didn't have them. I just wanted to.
You need to be honest with me.
I am being honest. I swear.
A few drinks and he's looking like this. There's something else going on here that doesn't make sense. What's his name? Patrick. I'm Dr. Jasper. Can you speak? He's really kind of groggy. He doesn't seem to be able to really kind of focus and say anything to me. What's your name?
Andy, I'm his cousin.
Did Patrick take any drugs?
No, sir. Patty just got accepted to the police academy. There's no way he's messing with me.
Cousin looked at me and he said with a straight face, we were doing no drugs.
In case 130 solid drugs are being.
This could be an intracranial hemorrhage, be an electrolyte abnormality or imbalance, could be even an adverse reaction to over-the-counter medications. Dispatcher, have any medical conditions or take any medications? Off 1 milligram of naloxone, and then 1 liter bolus of normal saline. Let's get an EKG, and then a CBC, CMP, UDS, ETOH, AEG, acetaminophen, and salicylate. The younger cousin is starting to really become more obtunded. Within minutes, he seems to be getting worse.
EKG's done.
Normal sinus, looks normal.
Rest for 6, that's her dropping.
My patient is now taking really shallow, slow breaths. 2 nasal trumpets, please. Nasal trumpets are like big straws, and that's usually my big gun. If I put in 1, I'm worried about you. If I put in 2, I'm extremely concerned. So I put in 2 nasal trumpets to protect his airway. And initially, I get a great response.
Whoa, Patty?
He almost seems to lift up off of the bed, and he takes a deep breath. But that was really short-lived. That's not enough. I need to intubate him. Let's go, intubation tray.
Spring is in the air when Dr. Matt Valente arrives in his ER.
Hey, what's all the commotion about?
Cheryl just got engaged.
Congratulations.
Thanks, Dr. Valenti.
There was definitely a time period in my late 20s, early 30s where it seemed like everybody was just getting engaged, everybody's getting married, and it's just one after another.
So you've been married 3 years now. Any advice for a single new grad?
Yeah, lower your expectations. No, I'm just kidding.
My wife's amazing. I think that the key to a good marriage is understanding and being able to work through your problems together.
Seriously? What are the chances?
I see the lady in a wedding dress.
Just stop begging me already.
In the hospital. Yeah, but we're only here because you never listen to anything that I say. Let me just talk.
She looks anxious, she looks nervous. I see that she's got her finger stuck in a jar.
She tried to do her wedding makeup. Can you believe it? I told her to hire someone.
Let me take a look at it and see what we can do.
You need to relax. You try to relax. We're having a wedding disaster. We're constant begging.
So how did this happen?
I was just getting ready for the ceremony, doing my makeup.
I can tell that her finger is swollen. I'm just wondering how I can get this out. It's clear that she's getting ready to go to her wedding.
I wanted to use it in this jar and my finger got stuck. What? I didn't say anything.
She didn't use the tip of her finger. She bent her finger.
I've been trying to get off for the last hour. I've tried petroleum jelly, oil, butter, you name it. I'm not gonna miss my wedding.
The problem was the more she tried to twist her finger, the more swollen it became, and then it started becoming painful.
Cheryl, grab me some ice packs.
Applying cold packs would actually reduce some of the swelling to that finger.
Cheryl, can you grab some glue?
My first attempt is just manual extraction.
Thank you.
So I grabbed a little bit of lubrication to keep in the emergency department, and I put it on, and I tried to twist and pull her finger.
Relax.
But it was clear that it was stuck and it wasn't going to come out so easily.
It sounded really tight. Sorry, Patricia.
My next attempt was the common tools that we stock in the emergency department to get rings off.
Let's try the ring cutters.
We have a manual ring cutter and a ring cutter that's electric. Try to relax your hand.
But still.
A manual ring cutter is like a nutcracker. It has a circular saw blade, and it has a thick metal piece on the other side so that you can put it in between a small ring, and then you start grinding it manually, and it's not even making a dent.
Let's try the electric.
So I grabbed the electric powered saw.
Don't move.
Unfortunately, neither one was cutting through this jar. This was a thick glass jar.
Wedding will last by 2 hours.
I'm thinking her wedding tonight is pretty much over, unless we can come up with a quick fix.
Doctor, it's the patient's family is still here. What's my husband?
He may not make it. If there's anything you want to say to him, I want her to say it now.
Really concerned because the post is in a critical area of his body.
What do you mean?
His injuries are potentially fatal.
Y así es como te atreves a comparar. Nada como ver a un cliente feliz y disfrutar mi nuevo seccional Bosch, envuelto en la comodidad inigualable de asientos de Pogo Critic Memory Foam, con 3 cojines que ya vienen incluidos. Seguros de que no van a gastar cientos más como si se hubieran comprado un sofá similar de la competencia. Y lo más importante es que...
A la gente sienta gratis.
¡Exacto! Si es que ahorras cuando te atreves a comparar, en tiendasfundadbox.com.
A young bride's wedding is 2 hours away. But first, Dr. Valente must find a way to save her finger.
Is there something else we can use?
We could try cast saw. Cheryl, can you grab it? Don, the next thing I could think of that could potentially cut this jar, that was a cast saw. We figured that if a cast saw could cut through plaster, then it might have a chance of cutting through glass. Singer Kathy. You're just making it worse with the cast saw. We grab the cast saw. Hold your hand steady for me. We plug it in, and we start it up. Didn't take long to realize that this wasn't going to work either. The blade's just not sharp enough.
This can't be happening.
She became more terrified. She realized that now I'm starting to exhaust some of the things that I routinely do. Each step along the way, as we had one failure after another failure, you could see she was worried she was going to ruin the biggest day of her life. At that point in time, I told her, I said, I think we need to consult a hand surgeon.
Whoa. Did you just say hand surgeon?
Then the mother comes in, and she is fuming.
Pat, you never listened to me. I told you to hire a makeup artist. What's all this about a hand surgeon? Enough already, I get it. Both of you. I didn't even say anything.
Now we've got 3 people. They're all bickering. They're all yelling at each other.
You always bring me into it when I haven't done anything. Don't pretend like you haven't been on my case since the moment we got here.
It's out of control. It's chaos. Hey, guys, we need to remain calm. We'll get this thing sorted out.
Well, do you think maybe you should call Carl and tell him you might be a few minutes late? Absolutely not. Jenna, give me my phone.
She doesn't want her future husband to know that anything's gone on, and she still thinks she's going to make it to the wedding on time. I've exhausted all the ways that I can think of how to get your finger out of this jar. So I actually discussed with her at this point in time that we've got probably a few options. Like I was saying before, I need to talk to a hand surgeon about having it removed in the operating room.
Oh, operating room? Well, I assume you're talking about the jar, not her finger.
Yeah.
This can't be happening. Yeah, the makeup artist in this wouldn't be happening. There's gotta be something else you can use.
We can call maintenance and see if they have any other tools that we can try.
It's a no-brainer. Get maintenance.
Cheryl, get Todd from maintenance, see if he'll come down. Maintenance has access to much more heavy-duty saws. Our saws are really just reserved for ring cutting and for removing casts. We don't generally encounter people that have, bigger pieces of metal or, other devices or objects that are stuck on their body that we have to remove.
So this is what I was telling you about.
So when maintenance came down, they took a look at her finger.
Put that stuck on there.
Yeah, I realized that.
So maintenance said,
I think a diamond trick will get other than the trick.
Great, let's do it.
Well, I can't do it right away.
unfortunately, we don't have diamond-tipped blades in the hospital. Well, can we go get one?
Yeah, there's a hardware store just down the street.
Well, let's get a move on it.
Andrea, can you take Todd and go to the hardware store and grab one for us?
Sure, Doc. Thanks for letting me.
She finally calms down and she asks me, she says,
What are we looking at here? What's the worst case scenario?
I told her that at this point in time, my main concern is that she could be losing blood flow to her finger. Unfortunately, because her finger was bent inside, there was no real good way for me to assess how her blood flow was to that finger.
What does that mean?
It means that we have to get that jar off within 6 hours. After 6 hours without blood flow to your finger, and it results in permanent damage. And finally, come out and I flat out say that she could lose her finger from this,